So hi and welcome to Grace Health and Fitness, and welcome to the first of our sort of mini interviews with some local and maybe not so local sometimes professionals who work in the field of health and fitness and well-being. I want to use these interviews just to share a little bit of my passion for women's health, but also share some of the stories and experiences of some other women and their relationship with health and well-being. And so tonight I'm with Sam, who is going to introduce herself. And she is someone in East Kilbride, or no, we're not in East Kilbride, Cambuslang, but not far from East Kilbride where I am, who I met a few years ago, partly through work, but also because I went to her for treatment. So over to you, Sam. Who are you? And tell us a little bit about, how you got to doing what you do work-wise, and yeah, how you ended up there. What's your experience?
Well, thank you for that introduction, Sarah. So yes, my name's Sam. I like to call myself a soft tissue therapist, which really is the same as a massage therapist, but it's with a few extra skills added on. So typically when we think of massage, we always think of, touching and stroking and manipulating muscles for results. But the work I do is sometimes a bit more specialized. So this is why we like to introduce the term soft tissue, because we like to think of more manipulating and assisting the fascia and even the skin. So I do a lot of scar work, which is probably where a lot of my passion is. But I work a lot with prenatal, postnatal, post-surgical, and general remedial work. So yeah, I'm based down in Cambuslang, which is in the sort of east side of Glasgow, but I have clinics up in East Kilbride as well, and then out of my home studio. It was quite a long and windy journey to get to where I am now, not like thinking wise, but in terms of becoming a therapist. I'm 44, and when I first moved to Glasgow after my degree, which was in like a joint arts science degree, I just didn't know what I wanted to do. Well, I kind of knew what I wanted to do, but that was kind of working in environmental science. And actually the openings just weren't there, and it required further education at the time, which I didn't have the kind of financial funds for. So like many science graduates, I actually ended up working in finance. And to cut a long story short, I went from finance to primary school teaching, back to finance. And it was when I was working in finance for the second time, my partner, who's still my partner, and we've got a lovely 7-year-old son together, was and still is very into fitness. So he does triathlons, and he inspired me, and I started running and sort of thinking more about my own health. And as such, I used to go and see a massage therapist, and it just blew my mind away. Like the fact that this person could put his hands on me and my niggles would disappear. He could resolve issues. And I thought, I want, this is fascinating. I want to know how this works. So I was, the second time of going back into finance was only ever meant to be like a stopgap. And I thought, do you know what? I'm going to train as a massage therapist. So I trained for an amazing college called the Western School, who are based down in Ayr, but they run their courses up in Glasgow. And in fact, did you train for them as well?
No, I did my first massage course at Cardonald College because I did aromatherapy in Swedish, and then I was up in Aberdeen when I wanted to do my sports remedial. So I trained with Scottish massage schools,
right?
And I think most of their courses are up there, maybe some down in the borders. So yeah.
Yeah, so they're all of the same kind of ilk in terms of standards. And it was just, it was like going through a gateway to a whole new world, which I didn't know existed. And you do like 9 months of Swedish, and then, as Sarah said, went on and did 9 months of remedial and sports. And it was just fascinating. You know, so much anatomy, physiology, learning about how the body works, things I just never even thought about. And I thought, my gosh, this is a revelation. Why didn't I know this stuff about my own body? You know, it's kind of, I can't believe all these people are walking around and they don't know like how this works. You know, it's kind of the way I am. Anyway, but then it was very fortuitous, because whilst I was studying for the remedial and sports, I fell pregnant. In fact, I was probably about 5 months when I graduated from that course. And I think that had a big play on me. Because I then had my maternity leave to really reassess my life and take that plunge and say, right, I don't want to go back into finance. Let's change my life and make this my career. You know, now is as good a time as any. And I think the other thing that happened was, because I had just recently been on this prenatal journey, and then this postnatal journey, which for me involved an emergency C-section, it opened my eyes up to what massage and soft tissue therapy could do for my recovery. So I don't know about you, but when I did sports remedial, it was an absolutely amazing course, but it had like a page, it had like a paragraph about how massage could help with scar tissue. And for some reason, this paragraph stuck with me. And after my C-section, I thought, I remember that paragraph. I'm gonna see what happens. And I used my skills, you know, the newly learnt tools of my trade, and used myself as a guinea pig in my own rehabilitation. And you know, a year down the line, so as my boy turned 1, I then actually went and did a pre and postnatal remedial massage course with bowel education, which I know obviously you're very much involved in. And that also had a section on C-section recovery and scar massage. And it was as if, you know, this was like, this is also real. So the stuff I did on myself, it is a real thing. And, you know, it consolidated it for me and, you know, enhanced the skills, enhanced the techniques, and allowed me then to go out and work with women in that situation. And I think that's what really then sparked for me on a journey of focusing on women's health. You know, prior to that, I was all about sports. Oh, I'm going to come out of this and I'm going to work in a sports team. And then that just was like, no, there's no way. I want to work in women's health.
And there's plenty of, you know, massage therapists in that realm, really, do you know, and whereas there's not as many who are specialising in what you do. So tell me a wee bit more about your sort of maybe more current area of expertise, the sort of scar work, and how you use that, where you would use that, because I know for probably a lot of people listening, they maybe don't even know that you could massage a scar. You know, what scars can you massage? I mean, don't go into, you know, too much science, but just, you know, it is a thing, and what kind of stuff can be done.
Yeah, absolutely. And I think this is a really big issue, because most women's response is that, is that even a thing, like scar massage? So the work I do is primarily to improve the function of the tissues. So that's enhancing the way that the tissues work. And with that, then you improve the feel of the area, the sensation of the area, which I think is such a huge thing. You know, if we take a C-section scar, for example, a lot of women post-surgery will feel quite disconnected to the area. The area, you know, is quite numb or desensitized. And it just becomes almost a bit of an alien part of them, you know, and no one should have a piece of their body which feels like that.
Yeah.
And then as a result of all of these things, you can also improve the actual look of the scar as well, and how the surrounding tissues are sitting with that scar. And I think the biggie is that post any kind of trauma event which creates a scar, whether it's surgery or an accident, your body will adapt to change to incorporate that scar and the scar tissue. And the problem with scar tissue is it loses its elastic properties. You know, it's really, really good at doing what it does, but it doesn't have that same flexibility as the surrounding tissues. So it kind of creates restrictions. And the body just gets on and functions, but you have a new normal after this scar. And for a lot of people, they don't realize that this normal has changed for them. So they'll have restrictions throughout their body, which is simply caused by this one piece of scar. You know, people are always amazed when they come to me and post treatment, they're like, I can actually move my shoulder, my arm much better. I had no idea the two would be linked. You know, and it's allowing the body to move and function and work optimally. And if you've got a scar restricting that, then you know you need to address the scar first. So going back to your original question, a lot of people come to me because they have C-sections. You know, and a really common thing is that disconnection to the area feeling numb, that kind of tourniquet effect of a scar, which kind of means that tissues sort of sit on it rather than flush. But I'm intrigued, very, very intrigued and passionate and interested in a lot of abdominal scarring, because I think it can have such a profound effect in such a very important part of our body. So I see people for like hysterectomy, appendectomy, so that's like appendix removals, keyhole surgeries, so laparoscopic. But I also, so more recently, so a couple of years ago, I did a very intensive scar training course with a lady called Emma Holly. And their courses are much more sort of science-based, and you know, they're trying to fund research to really show the evidence behind scar treatment. But this course enabled me to really work on all types of scars. And I think the biggie which came out of it was scars post-cancer treatment. So, you know, oncology treatments such as radiation therapy or mastectomies, lumpectomies. So you can get really lovely, amazing results to help a person with that healing process, which, you know, it takes so much time post, you know, when you've had something so invasive. You know, the treatment is obviously so unpleasant. You know, being able to nurture your body afterwards is just so lovely. So, yes, that's.
And I guess you're kind of touching on it there, that there is a kind of, there's the kind of emotional and psychological element of the work that you do when it comes to scars, because you kind of said that kind of disattached kind of feeling. And, you know, like you say, whatever's caused that scar, there will be some kind of emotional connection to it as well. And so, you know, you're not just going in there and starting to mess about with someone's scar. There's, you know, it's a really gentle process, isn't it?
Absolutely. And I think, you know, you've hit the nail on the head by saying it's so gentle. You know, the body will only allow you to what's the word? I can't think how to describe it actually. So it is incredibly gentle, and that there can be such an emotional outlaying from it. And I think you need to address the emotional side of it as well, whether it's through touch or through another therapy. So often I work, you know, alongside other therapists. But what people do find is that sometimes addressing the physical side can then help the mental health or emotional component.
Yeah, okay. And I know that you have a C-section resource that you developed, I think, last year for women. So tell us a little bit about that for anyone listening that maybe is due for a C-section soon, or maybe hasn't long had one. I mean, how long after one could people use your resource?
Yes, so I developed my C-section resource pack. I know it's not a very snappy title, so I should think of something else, shouldn't I? I developed that during the first lockdown. So I think when you're employed any which way, whether it's self-employment or, you know, through another business, lockdown's tough because if you're not working, then you have to find something else to do with your time. But for self-employed people, that usually involves then like just doing other components of their business. Like once I'm self-employed, always self-employed. You're never like, you know, your hours are never shut. So I spent the time working on this resource pack. And the main aspect of this was providing education for women about their, you know, either elective C-section or the C-section they've had. So there are chapters on preparing, but equally those chapters go into the science behind wound healing and how good preparation actually will lay down the groundwork for a good healing journey. Okay, so my intention was that people could access the resource pack and become more in control of their own recovery. And I think this is a really big thing because, you know, I experienced it firsthand. I came out of my C-section and no one was interested by the fact that I had just had this major abdominal surgery. And if it wasn't for my own knowledge, then I would have not been proactive in my healing journey. So the resource pack is predominantly from the aspect of wound healing, scar work, scar massage work, being able to do work yourself on it, but also takes into consideration things like nutrition, breath work, returning to exercise, and mental health aspect as well of going through a C-section. So obviously people can purchase it who are going for elective section, but I would say there's chapters in it which are applicable for anyone who's had a C-section, whether it's, you know, 5 months ago or 5 years ago, because I think this is a really important message about scar work. It's never too late to make a difference to your own scar. But sometimes in order to make the best difference, you have to understand what your body's gone through. So whether you're reading that material, you know, much further down the line, it's still going to stand you in good stead.
Yeah. And we can maybe put the wee link to it at the bottom of wherever this video goes. You know, if you want, stick a link to where people could find that, that'd be helpful.
Yeah, and I think the other nice thing with it is we have like an online Facebook group to kind of support people on their journeys. So with that, you know, we have like little interviews in there, and I'm running a short course at the moment where there's a small group of us who are you know, coming into like Zoom lives and just discussing how they're getting on with the self-massage work. Do they have any questions? Do, you know, being made accountable for it, because it's very easy to say, oh yes, I know what to do, but then actually getting around and doing it is a kind of different matter. You know, and actually the ladies in the group, sort of one's 2.5 years post C-section, there's all sorts of different, you know, it's not just recent.
Yeah. And I guess it's good because people can use it from wherever they are as well. It's not a face-to-face thing, and particularly just now, you know, when there's maybe people feeling quite isolated, you know, if this is your first time and you are booked in for a section, you know, and you know there's maybe not that same level of, you know, contact and support just now with lockdown, you know, then again, it's like it offers that wee bit of connection and community as well, which is lovely.
Yeah, absolutely.
So tell me, what's your favourite part of your job, Sam? You obviously sound pretty passionate about it. What's your kind of what's a good day for you in the office?
I think the favourite part of my job, and I know you'll be able to relate to this, is that the main thing about my job is that people don't come to me and they're not passive in their engagement. That's one way. They don't just lie there passively and have something done to them. So the whole point of any remedial work is that the person receiving the treatment is actively engaged in their recovery. And I think the favourite part for me is when someone fully takes that on board and makes changes which will last them a lifetime. And whether that is subconsciously in terms of the work I do on them just gets integrated, and for whatever reason it's just push bam what amazing results, which is always just like lovely when you see it, because their body has just responded so well, or it's that they've gone away and processed the education you've given them, because it's never just about doing something to someone. You have to involve them, you have to tell them why they're getting the pains they are, why they're in the discomfort, what is causing their chronic pain, and allowing them to make the changes necessary for them to take them out of that pain. And you're helping them along the way, but you're not the reason, you're not creating those radical changes, they are. And I think when that happens, that is the most satisfying thing. That's the purpose of my job.
And I think as well, like I agree with you there, and I think for some that's like a journey, isn't it? And for some that does happen quite quickly, and they're in a place where they can take the advice or the experience and run with it and make good those changes or whatever, and get they're ready for it. And for others, like you say, they can come back maybe in a while, their life gets in the way, and we have good intentions sometimes when we seek help for something, but then we something takes over. But it doesn't mean that all of that's lost. They could come back in 6 months' time and pick up in a sense where you've left off. And I think a lot of the work I do as well, it can be like that sometimes. You've got to allow yourself to just take your journey at your own pace. And
there'll be setbacks, and I think particularly during this time where you can't consistently see people, it's been quite start-stop, so you have to appreciate that things have gone on in the interim, and you just pick up where you left off and reassess and reevaluate and take it for what it is.
Okay, fab. Well, that's given people, I'm sure, a really good insight into what, you do, and what other maybe, if they're further away from you physically, then what a scar, massage therapist, if they're able to find someone who is, properly qualified, what you would do. And the last question I had for you, and I did give you some warning, was if you had, one message for women out there listening, what would it be? And it can be whatever you like, personal, professional. What's your token advice?
It's probably actually going back to what I've just been speaking about, in that don't be passive. Well, no, actually, I think as women, we have it slightly tough because we have lots of stages in our life where things are a bit out of control with our bodies. So we're just blaming hormones. Okay, we've got puberty, we've got our 20s, which I'm sure like my hormones are still ranging in my 20s. Pregnancy, postnatal, perimenopause, menopause, postmenopause. And I think it's really important that but as women, we are not just passive recipients of all of these stages. There's lots of choices out there. It's just a case of getting good, realistic education, whether that's reading or through podcasts or, you know, listening to a variety of different experts, and then making those choices, but but kind of taking control.
Yeah.
Because it kind of goes back to that kind of cliche of control for controllables, you know. And I think in modern life, there's so much we can control. So why don't we control those things which are really, really important to us, like our own bodies, you know, and just be a bit more engaged with ourselves. That's not a very short answer, sorry.
No, perfect. And I totally agree with you, you know, and I think, you know, we deserve it. You know, women deserve it. And I think sometimes that for some women, it's not that you, you know, you don't want to do these things. I think sometimes we just put ourselves bottom of the pile, you know, or, you know, we don't think, you know, I don't know, that we deserve it or whatever. We've not got that kind of confidence to grab it and to think, right, what can I do about this? So, you know.
And it's hard knowing where to grab the information. So at the moment, I'm 44 and I'm pretty sure I'm perimenopausal. So this is my big thing. Like, I am just like sucking up the information, like as soon as it's given to me, because I want to know what's happening to me. And I'm blown away by the fact that I didn't know any of this stuff. And you kind of, it's quite scary and quite shocking. You know, at school we get sat down and we get talked about puberty, albeit probably not in, you know, a great way. But, you know, and so many teenagers really struggle with mental and physical health at those times. And you know, if you can't get that right at that age, you know, it's
No, I think it's so important for all these different life stages, to get as well informed as we can from as many places, you know, until there's something that fits with us, maybe. So, Fab, any last words or anything else before I close you up?
No, it's just been fab. It's been fab talking to you, and I've loved it. So thank you very much for giving me the opportunity. I hope what I've said has made sense. I do. I'm not the greatest at kind of talking and explaining myself.
I know we've all
had it down to perimenopausal hormones and a bit of brain fog.
Yeah, well, I know. I thought it's strange for everyone, but I'm enjoying, you know, being able to do some of these kind of things. So it's nice to have willing participants. So thank you so much for your time. And I will say that if there are questions maybe specific to you, then we'll make sure that they get passed on to Sam, and we'll put her link to the C-section resource pack as well in the, you know, the bottom of whatever this is posted in. And you'll be able to find Sam through that if you'd like to meet her in person one day. So thank you for joining us, those who've watched it or listened to this, and I look forward to sharing another little story with you again very soon. So take care, bye from us.